of the Center for Family Health, current CEO Bill Wypyski and retired CEO Molly Kaser. Welcome to the show.
Thank you.
Thank you.
This is great being here.
Nice to be here.
Opening the door to healthcare for all for 35 years. Let's go.
You know it.
You
know
Andy,
it.
well done.
How about
yeah,
that?
I'm impressed.
It's amazing the growth. What year did you start?
So I was hired in 1990
Wow.
to get it up and running, and we opened early in 1991. So it was a long time.
You must be
Long time
proud
ago.
of, the growth and the service
Yes.
and the amount of patients that are seen every year by
Yeah.
the center.
It
You don't
has
remember.
filled a need.
Yes, I do.
You were just 10.
I remember. It was behind the Wendy's.
Now,
There you go. That
That's
was
right.
our
How
original
did
building.
I remember that.
how did it
Yeah.
start, Molly?
Pardon?
How did it start?
So, as you recall, pregnant women in Jackson who had Medicaid or who were uninsured were being shipped to Ann Arbor and Lansing for prenatal care and expected to go there for deliveries. And many didn't make it. They made it to the ER at our local hospital. High infant mortality rate, and then of course once the babies were born in Ann Arbor or Lansing, local pediatricians said, well, if the baby wasn't born here in town, we're not going to take care of them.
Oh, wow.
So it was a double whammy. So Marcia Krucher stepped forward and said, we're going to do something about this. That's paraphrasing a long conversation,
Yeah.
of course. So yeah, Marcia gathered quite a group of supporters behind her and got the funding together, and we were able to open and immediately saw a lot of other needs. Primary care. So in '94 we started primary care, and then became lots of very exciting things happened.
Lots of milestones over
Lots
the
of
35
milestones,
years.
yeah, and all of it because we had a lot of support from many sectors in our local community. Lots of wonderful support. Still a lot of need out there. It doesn't go away,
No.
as we've
it does
seen
not. It does not.
recently.
Yeah, it's been actually quite amazing. I'll be here at the Center for Family Health 3 years in May, and I've just I fortunately have met Molly. Molly reached out to me even before I got here. I think there was like a little note, and she's been just a great support. And it's a legacy to live up to. She wouldn't say that. I'll say it. And yet, the thing that Molly left behind is a leadership team and a staff that know how to do their jobs, the dedication that they have, and the love for the community that they share and act on every day. It's been a joy and a pleasure to be able to kind of take the baton and keep going down the road.
It was pretty revolutionary when it started because there wasn't a model like this anywhere, and it didn't even count as a federally qualified health center for the first several years.
Actually, for almost 10 years, yeah. Certainly as a prenatal clinic, it would not have qualified, but once we started providing primary care, that's when things changed, and we were able to go after that designation, which was a game changer. It made all the difference.
Yeah, absolutely.
But most health centers like ours started in some unique way, responding to what's going on in every community.
Yeah.
It's all a little bit different, but the basics are still there: a lack of access to care and people without much in the way of health insurance.
That's right.
Who have a lot of non-medical needs as well.
What are the milestones that we're celebrating in year 35?
In year 35, what are we celebrating,
Well,
Bill?
I'll tell you, we are celebrating a lot of things. One thing I do want to mention is that the shout out to the Community Health Center movement. I just came back, I was in DC a few weeks ago, and it celebrated its 60th anniversary.
Wow.
So this whole movement got started in the mid-60s, and it was really all about filling that what ended up being a large hole for people who couldn't access care, the resources weren't there, and or they couldn't afford them. And over the years, I think we're over 1,500 community health centers nationwide, 41 here in the state of Michigan.
And I always say, if we all had the same name, every health center had the same name, people would understand what a big network. It truly
Yeah,
is.
sure.
But because each is operated and owned at the community level, we all think each one is, isn't that amazing?
Right.
And it is, but it's part of a bigger network
Sure.
with a lot of shared information.
Well, ours, I think, is the best.
Yeah, of course.
You
I
talk
would
about
agree.
filling the gap. 31,000 patients seen last year.
Yeah,
That
yeah,
number is
yeah.
amazing.
Yeah.
And we're looking at some of these milestones that that you've gone through, but you're continuing to add milestones to this list.
We are, and I think, again, going back to the foundation, I wasn't in the buildings that Molly and her staff were in back in the early days. But I think of one big milestone, but it's getting on to 14, 15 years now, are the buildings that we have today, both at 505 North Jackson as well as across the street at 500 North Jackson, and then the 4 clinics that we have, school-based clinics, and then we have an embedded nurse practitioner over at Lifeways. And that, again, Molly really led that charge to all these different places to meet the needs of our community.
And of course, the pharmacy has been. I had a chance to get a tour of the pharmacy, and it's amazing. And your seamless continuation of care from the walk-in to the pharmacy. That you have a drive-through. You're open Saturday.
Yeah, we just got started opening on Saturday in pharmacy.
That is great news.
Yeah.
Pharmacists are really the unsung heroes in healthcare. People, I'm always amazed how knowledgeable they are, and they love to help people figure things out. They can figure things out that physicians aren't able to, just because they know all these medications and options. So,
And I believe you have 6 pharmacists.
I think we're up to that.
Yeah.
I was thinking it was 5, but I almost think, yeah.
I think Raphael told me that when I was there.
Oh, is that
6.
right? Wow.
Yeah.
Yeah.
Impressive.
it is. Yeah.
And he's looking forward to being able to have time with patients. He does that now, but also having time with the providers. And my sister is actually a pharmacist, and she has said that to me for decades, that they get underutilized, like you were saying.
Absolutely. There have been studies that have been done that show that if you have a pharmacist embedded with a primary care, you have much better results for things like diabetes and high blood pressure, because the pharmacist is going to, they know tricks, I'll call them tricks of the trade, that are very manageable for people.
Exactly.
So,
Well, I think just the simplest is being co-located. It's, when people leave the doctor's office with their script, maybe they don't swing by the pharmacy right away.
Right.
Not everyone has the transportation either, or the
or the money.
Yeah, that's right.
Yeah.
That's true.
Yeah. And
Money is a big factor. Even if you have insurance, a lot of times the co-pays are unaffordable.
Yeah.
Or if you have deductibles.
And we work hard to get that medication in a place that they can afford it. There's lots of things you can do. The other thing is when they do go to the pharmacy downstairs, they can also then talk to the pharmacist for any questions right away. So we love that.
Well, it started as a women-centered health provider, but it's grown into being so much more. But we still have that focus on women, and this is Women's Month, and
that's
we've
right.
got next week is Women's Week. And all the month, I think we're celebrating.
Yeah. We're also celebrating this week, and I think it's tomorrow officially, Employee Appreciation Day.
Very nice.
But we're doing the whole week. So we've been doing lots of cool things at the health center. In fact, actually today, I think there's a coffee truck coming up for people.
Oh, that's
Then we
great.
had lunch for the staff, and we've been today is also, I didn't bring mine, but like Music Appreciation Day, so folks have T-shirts on, and it's great. It's great. At the end of the day, you can't do anything without the staff, and we have great staff. We also have a great board. Shout out to the board. And there are board members that Molly well remembers that are still with us that remember the inception, the beginnings, which is amazing. The longevity's there and the history's there, and the appreciation for what we've done over the years. It's a great thing for Jackson.
Absolutely. Thanks for being here today.
Yeah, congratulations.
Yeah, nice to see you both.
Yeah, and more to come throughout the year. On 35th, we're going to have a number of events, and I'm sure we'll be inviting you guys.
Thanks so much.
Thank you, guys.
President and CEO, past and present, Molly
Here we
Kaser and Bill Wypyski. More of the morning show after this.